Hello, everybody. My name is Mike Mulqueeny. I'm an employee benefits consultant with Johnson & Dugan, and we're in the San Francisco Bay Area where we've been helping employers, small to medium-sized employers for the last 38 years with their employee benefit programs. Today, I'm joined by Heidi Oja, a co-founder of Aware Health, where we are speaking about MSK claims, this being the third in a series of 3 small little webinars on how to reduce claims or bring claim strategies to self-funded employers. So rather than ramble on that, Heidi, why don't we just jump right into it? Thanks for joining me. Heidi is a co-founder of Aware Health. She's been a clinician of 15 years with her doctorate in physical therapy and the top cited researcher in the world on how direct access models can lower orthopedic claims cost. Mouthful.
Yeah,
so
mouthful, but I'm super passionate about it. So
I know, and I've enjoyed having you for this series. So let's get to it, Heidi. So what is the status quo? 6 million surgeries performed in the U.S. annually. MSK types of orthopedic surgeries we're speaking about specifically, but many friends have researched surgery and have improved. Talk to me about this dynamic of having a surgery.
Yeah. I'd like to even broaden it a little bit larger than just talking about surgery, because I think it's very rare to see an orthopedic surgeon and have them recommend surgery right off the bat. I mean, most orthopedic surgeons are conservative and will try other conservative measures first. But I just kind of want to explain the timeline that I see time and time again, where somebody enters the medical system, the primary care physician might not know what to do. So they'll be like, let's play on the safe side, order imaging. And then, an employee will see the findings on that imaging. Probably they're incidental, meaning the findings were there before even having the pain in their knee or back or wherever it might be. And then they'll get sent to an orthopedic surgeon sometimes. The orthopedic surgeon will be like, well, let's try an injection first. Let's try physical therapy. And so that whole process starts. And then eventually a portion of those will end up electing for surgery. And the biggest thing that I've noticed is that pretty much every single thing that's done through the insurance-based system is passive. Passive meaning it's prescribing medication. You're not actively involved in that. You're just taking the medication. Injection, you're just sitting there and receiving it. Surgery, you're pretty much like knocked out on the table. That's passive. And all the treatments that are supported in research for muscle, nerve, and joint pain are active, meaning you're stretching, you're strengthening, you're actively participating. And even changing the way you think about your pain is active because you're using your brain and your nervous system. And so we're trying to put all of those active treatments on day one for the employee. And those are the ones that work. And we occasionally send them onto the insurance-based system if we feel like there is an immediate need for surgery. So that could be cancer, needing potential surgery to remove it, those types of conditions. But very quickly, we can determine on that day one with our skilled orthopedic clinical specialists if there's an indication to use the insurance-based system or not. So I would say, 98 to 9% of the time, employees just get better in our telehealth system and don't even need to use their insurance company. So that's all cash back in the employer's pocket.
Right. Yeah. Dollars not spent for sure. So how are you getting 8-to-1 ROI with your initial clients?
So first of all, I just want to say 8-to-1 sounds really good, right? And that is our actual ROI with our Stay-Well clients that we worked with, which was the last series in this 3-series webinar. But we also had introductory costs. So our costs weren't as high, and also it's a short period of time. So cost out is highly skewed, and just over 6 months, it was a group that we incentivized with gift cards, and we're like really trying to get good engagement. So we got 45% engagement, which is really good. And I think that's why our ROI was so good. We expect to be able to repeat that, but it might change based on employers. So I just kind of want to mention that caveat.
Good. Wow.
The 8-to-1 ROI probably comes from our upstream approach. I don't think any other vendors are intervening day one and really trying to change people's ideas about their beliefs about pain, and have the skill and knowledge to determine if somebody needs an MRI or if somebody needs surgery on that first day. And our providers are very confident about that. They have more training than any other provider, including orthopedic surgeons, in the non-surgical arena for muscle, nerve, and joint pain. So I think that's what we can attribute our cost savings to.
That sounds really good. Yeah. So have you had cases where someone was thinking of or had a scheduled surgery? Did they cancel it? Do some need imaging and surgery? Why don't you talk a little bit about this?
Yeah, so we have had some cases where surgery has been scheduled and we're like, okay, do you really want to do this? These are other options. You could postpone it until you see if you get better with this program. And they actually did get better and cancel their surgery. So we've had those cases. This case is someone who came to us and they had already seen a surgeon at that point. So he went to the surgeon a couple of times and they basically gave him two options, either one surgery or two surgeries. Wow. Those were the two options. And so when he started our program, well, the two surgeries would have been costly, but it was also a year of his time, right? And time is so valuable.
Recovery.
That's the most valuable thing that we have.
Right.
And so he came to us and he was pretty much like, we use a functional scale from 0, not able, to 10, fully able. So he was like at a 0.83, I think, like less than a 1 out of 10 on a functional level. And by the end of our program, he was like a 9.5 out of 10. And the only thing he couldn't do with his knee was lift his washer in the deep knee squat position. But I'm like, well, you probably want to get a second pair of hands for your washer, you know, it's pretty. But he really progressed in a very short period of time, like 6 weeks. So I think a lot of times employees don't know they have options. And it's important that they understand telehealth can really be effective for even types of conditions that are, you know, determined to need surgery. And we have a program where they sign up, they enroll with us. So it's very low burden on HR. Everything's done through us. And they progress through these video tracks that we send them in automatic feed daily, and they can communicate with a therapist. So it's almost kind of like having a specialist on demand for your problems in a company and having that communication daily if needed. And we find that that is as effective or even more effective than going to a clinic and getting a problem treated. So we're really excited about it. And this is just one example of an employee. Wow,
that sounds very encouraging for a lot of employers out there. I'm sure lots of people that would fall into the same sort of scenario. That concludes our little 3 webinar series on MSK claims and how we can help employers reduce that part of the burden of their self-funded health plan. Thank you, Heidi. I really appreciate your contributions to this. I look forward to continuing the conversation with you. And if anybody would like to take a deeper dive, please reach out either directly to Heidi or myself. We're here for you and would love to hear about your program and how we can help. Have a great day, everybody.
Honored to be doing this with you, Mike. I really think highly of you.
Oh, thank you. I appreciate your participation. You have a great day. Look forward to talking to you soon.